2002, Iowa for Healthcare has been fighting for the hundreds of thousands of people in the state that go without health insurance. But they're not the only ones who are suffering in this nation's healthcare crisis, not by far. There are many Iowans and Americans who have health insurance, but they're really feeling the burden of skyrocketing healthcare costs that get heavier every year. The cost of insurance is keeping America's big businesses from competing globally and are now keeping America's small businesses from even surviving. As you'll hear in the Access Project report, Iowa family farmers, whose products we greatly depend on, are feeling this pinch now worse than ever. Years ago, a farmer might have to sell off a piece of his land to pay for medical care, and now he'd have to sell off the entire farm. It is inexcusable that in the richest country in the world, so many people can't afford access to health care. The American healthcare system is in need of real comprehensive reform, and this change needs to happen at the national level. Today, Iowa for Healthcare has released our presidential candidate healthcare plan comparison. We release it to you, and we also have released it in the mail to our over 32,000 healthcare voters in this state, and have asked them to get out and caucus for healthcare reform. By caucusing for the candidate that they think has the best plan to bring quality, affordable healthcare to every man, woman, child in this country. Because the longer we wait, the worse it's going to get. We must act now, and we must make this reform a reality. It's just so fitting that we're sitting here at an icon for rural America, rural Iowa. We're appreciative of the opportunity to be here, and we, though, now want to call on, because of the Iowa caucuses, we have this great opportunity. We have presidential candidates popping in and out of the state daily. Some of them are even living here now, and we want them to make sure that they include in their plans details to make quality, affordable health care for all reality. And then, you know, we have the possibility of the next president here in Iowa, or the next president to be here in Iowa, they're all here, and have that person understand that folks from all kinds of settings, small business and especially rural, need their support. And thank you very much. And I would like to introduce Chris Peterson. He's with the Iowa Farmer, Bill, did you want to go next? Sure. Sorry. Bill with the Access Project. He's going to present some findings from their report.
Good morning. My name is Bill Latero. I'm Field Director for the Access Project. The Access Project is a national research and resource center that supports health policy studies that then support local understanding, that can formulate new policy for the improvement of healthcare and access to healthcare. In 2007, the Access Project joined with the University of North Dakota Center for Rural Health and with our long-standing partner, Brandeis University, to gather information about the source, type, and characteristics of farm and ranchers' health insurance, as well as the financial burden of their health expenses that is placed on those farm and ranch families. Data was collected through a telephone survey of 2,000 non-corporate family farms in 7 states: Iowa, Minnesota, Missouri, Montana, Nebraska, North Dakota, and South Dakota. We had done this survey in partnership with the National Agricultural Statistical Service, NASS. The Access Project, in fact, will release the aggregate findings of that of our second brief, which is the cost of health insurance, and that will be released next week on December 18th. But I'm here today to speak with our local colleagues about Iowa-specific data. Some of the findings that include that 13% of all the respondents from that 2,000 sample were from Iowa. And of those, they were, by and large, 91% insured population. So these are people that are going out, playing by the rules and securing insurance. So how much are they spending? Well, the cost of insurance for them, on average, is $6,500. That's on average. But there is a section, you either buy it through one of your spouses going off farm and securing insurance, and you're paying co-pays and deductibles and those charges and costs associated with it, or you have to buy it on the individual market because all hands on deck in the farm to make it work and to succeed. Those people represent 37% of farmers in the Iowa study and in the aggregate study. Now that is staggeringly high of people purchasing on the individual market, which compares to 8% nationally. So a very, very large size of the population for farming families are buying on the individual market, which is the most costly source of coverage. So when we talk about a $6,500 annual cost, we want to look at the cost of individuals that are purchasing on that individual market. That cost is, on average, $10,850, much higher. So we have some real significant problems here in that 37% of the sample population is forced into an individual market, paying very high rates, $10,000 on average for those 37%. What happens to them? Well, they have to eat up their savings. They forego loans and investment in the farm. And then a significant portion of them, beyond the financial burden of securing and maintaining that coverage, even having coverage, accumulate medical debt. 20% of those insured families have medical debt. That is bills after having paid those exorbitant rates. So it is sort of like an umbrella that melts in the rain. You've spent very expensive insurance that then when you need it is not there for you. It does not secure you the financial protection for which you bought it. There are a number of other data points within this study, and I've provided those to you. What I want to make sure you understand is that this issue is not sustainable. The issues that are being revealed are not sustainable. What we have here is a system that currently is causing one in 6 of the farm families to have financial stress, 1 in 8 to have medical debt. If that's happening this year, with every year increasing costs of medical insurance, this is a train wreck. So year in, year out, health insurance costs are going up by 16, by 18, and on these markets, on the individual markets, much higher. Is that sustainable? Certainly not. And so there must be relief. When we're looking at the candidates and all of their proposals, we hope that these findings will provide you all with more salient questions to banter with those candidates about their plans. And one of the central questions is, how will your plan deal with cost containment? How will your plan ensure minimal, credible coverage at an affordable rate that is maintained at an affordable rate? And now I'd like to introduce Chris Peterson, who is president of the Farmers Union, and have Chris share his perspective and his personal story. Thank you.